There are different types of bowel operations. I guess we are talking about colorectal operations. What we do is very much dictated by where the tumor location is. So if we are dealing with a right-sided tumor, we would be doing a right hemicolectomy. If it is a left-sided tumor, we will be removing the left side of the bowel, which is a left hemicolectomy, or removing the rectum is called anterior resection. And sometimes we may need to do stomas, like colostomy or ileostomy. These are most of the time for temporary defunctioning purposes, but sometimes it could be permanent, and that's very much dictated by whereabouts the tumor is. Basically, excess is different. We are doing exactly the same thing, removing a certain part of the bowel and aiming to join the two ends together. But access to the tummy cavity in open surgery is done through a cut in the tummy wall. In keyhole surgery, we make smaller holes and use special instruments to access the peritoneal cavity and do the operation with those instruments. So when the cut, of course, or the cuts are smaller, the recovery is quicker. And also one added benefit could be if we do keyhole operations, the likelihood of having scarring inside is less. Because keyhole surgery has got its limitations, if the organs are stuck to each other, if the patient had multiple operations, abdominal operations in the past, having access through smaller cuts may be very difficult. And the idea is having proper access, proper views of the organs we are operating on, and doing an operation safely. So having a good operation is the important thing. It's not having it keyhole or open, but having a good, safe operation. That is the key. Most of our operations are not done as day cases. These are major abdominal operations. Most patients stay in the hospital for about 5 days, give and take, maybe plus minus 2 days. And recovery at home can take a few weeks, and after that patients return back to their normal activities. Even at discharge, we would expect patients to look after themselves and able to walk around and do basic activities.